Hello, I'm Dr. Puya Mahajer and I'm the Director of Spine Intervention here at Cellaxys. Today's topic is treating whiplash, how to treat a hyperextended neck. Hyperextension of the neck, more commonly known as whiplash, is an injury that is caused by the sudden backward and forward motion of the neck. Hyperextension of the neck can cause injury in the soft tissue such as tendons, ligaments, muscles, and the neck joints themselves, which are called cervical facets. Some causes of whiplash. Whiplash injury is common in motor vehicle accidents and are also caused by sports injuries, falls, assaults, or chronic neck strain. After a motor vehicle accident, most often rear-end collisions, patients may suffer neck pain and stiffness, occipital headaches, thoracic spine pain, low back pain, or upper limb pain and paresthesia. Symptoms of whiplash. There are a number of symptoms that indicate hyperextension of the neck. First and foremost is neck pain. This pain is generally felt along either side of the neck, at the other side of the spine at the back of the neck. Some of the more common symptoms include a stiff neck, headaches, muscle spasm, tenderness along the back of the neck, numbness or tingling in the arms or neck, shooting pain in the neck, shoulder, or arms. If you experience any of these symptoms after an MVA or trauma, you should seek medical attention. Diagnosis. Hyperextension of the neck is usually diagnosed by a medical history, a physical examination, and imaging such as X-rays, MRIs, or a CT scan. Typically, there are two types of injuries for whiplash. The first is called typical cervical hyperextension injuries. These occur in driver passengers of a stationary or slow-moving vehicle that is struck from behind. The patient's body is actually thrown forward, but the head lags, resulting in hyperextension of the neck. Rapid deceleration injury throws the neck forward and flexes the cervical spine. The chin limits the forward flexion, but the forward movement may be sufficient to cause longitudinal distraction and neurological damage. Whiplash-associated disorders, which is commonly called WAD, are classified by 5-grade scale, depending on the severity of the signs and symptoms. Let's move on to some treatment options. This includes ICE, over-the-counter medications such as non-steroidal anti-inflammatory drugs, heat, ultrasound, massage, physical therapy, steroid injections, and regenerative medicine therapies. Some of the regenerative medicine therapies include PRP. PRP involves taking a sample of the patient's own blood and centrifuging it to extract the platelets from the other components of the blood. Once the platelets are extracted and concentrated, then they can be injected into the damaged structures of the neck. This comprehensive approach to pain allows the body to heal from damage sustained during the whiplash. The PRP injections treat the damaged ligaments and tendons that were stressed and micro damage from the force of the injury while strengthening all the supporting structures of the neck. This type of regenerative medicine produces clinical outcomes that repeatedly outperform not only conventional approaches but also chiropractic care for the neck pain. Patients began seeing improvements after a few days, with the best results observed 1 month post-injection. Some patients also have the PRP repeated after 3 months if the pain returns. Patients can experience up to 80% reduction in pain and improve range of motion and functionality. Now the question is which treatment to choose. Depending on the severity of the neck hyperextension, it may be necessary to explore different treatment options. Be sure to consult a physician to best identify the proper treatment plan for you. Schedule an initial consult to see what options are available. Thank you for watching this video, and I hope this was informative.